What does it feel like when you examine a patient? Do they feel bloated? Do they feel, how do they feel? What's it like?
Well, actually the abdomen may feel normal. Sometimes it feels bloated, sometimes it feels normal. And that's why patients get actually frustrated because they say, well, doctor, I was bloated an hour ago. I looked like I was pregnant. And, but now I'm normal. And that tends to be very frustrating.
So what's going on with these people? What's going on from the GI tract wise? Why do people have these problems?
We think that there is actually an alteration in the brain gastrointestinal tract axis that deals with intestinal motility and the visceral sensitivity. So these patients either go too fast with diarrhea, too slow with constipation.
So it could be either one?
Yes.
Well, can you classify these in two groups? Are there some that have constipation all the time?
We can have the whole spectrum. We usually tend to classify them in three major groups: constipation predominant, diarrhea predominant, and pain predominant. People with the pain, goes to your question about bloating, they have a visceral hypersensitivity. And what do you mean by that? They have an altered sensation when it comes to gas. They perceive more gas than there's actually there. I'm not saying that they may not be more gas. Sometimes they're visibly bloated because their transit, the motility in the colon is lower.
How do you treat that patient? What do you do for them?
In terms of non-pharmacologic is exercise, high fiber diet, avoid things. They can sometimes identify food that may trigger their symptoms.
So will exercise help that, and will diet
Especially
help?
when it comes to constipation, it does help. Diet, high fiber diet helps with the diarrhea because it gives the stool more shape, and with the constipation, of course, to keep you regular.
There's a lot of high fiber medications. We all think of Metamucil or FiberCon, some of these. Is that what you have the patient do? You have them get prescription bulk medicines, or do you have them change their diet that they eat at the table?
I tend to do both. A high fiber diet is 35 grams of fiber a day, and that is a lot. So we usually supplement them with a fiber supplement like the ones you mentioned.
Do you usually get good results when you treat irritable bowel syndrome?
We do. We do. I actually will say in my practice about 70 to 80% of patients just require an increase in fiber because it decreases pressure in the colon, so it helps with that hypersensitivity and normalizes their bowel habits.